The 5 essential steps for first responders. Overdose is common among persons who use illicit opioids such as heroin, and among those who misuse medications prescribed for pain such as oxycodone, hydrocodone, methadone, buprenorphine, and morphine. The incidence of opioid overdose is rising nationwide. And to address the problem, emergency medical personnel, healthcare professionals, people who use drugs, and other community members who may witness and respond to an overdose are being trained in the use of opioid antagonist medication naloxone, which can reverse the potentially fatal respiratory depression caused by opioid overdose. Naloxone has no effect on non-opioid overdoses, such as those involving cocaine, benzodiazepines, or alcohol. However, we do use the Narcan because we can't know which drug they have overdosed on, so we go ahead and use the Narcan anyway. Here are some of the steps that have been outlined to reduce the number of deaths resulting from opioid overdoses. Step 1. Evaluating for signs of opioid overdose. Signs of overdose, which often results in death if not treated, include unconsciousness or inability to awaken, slow or shallow breathing or breathing difficulties such as choking sounds or a gurgling, snoring noise from a person who cannot be awakened, fingernails or lips turning purple and blue. If an opioid overdose is suspected, stimulate the person, call the person's name. If this doesn't work, vigorously grind knuckles into their sternum or rub knuckles on the person's upper lip. If the person responds, assess whether he or she can maintain responsiveness and breathing. Continue to monitor the person, including breathing and alertness, and try to keep the person awake and alert. If the person does not respond, call 911, provide rescue breathing if the person is not breathing on their own, and administer 1 dose of naloxone. Step 2. Call 911 for help. An opioid overdose needs immediate medical attention. An essential step is to get someone with medical expertise to see the person as soon as possible. If no emergency medical services, EMS, or other trained personnel is on the scene, activate the 911 emergency system immediately. All you have to say is someone is unresponsive and not breathing. Be sure to give a specific address and/or description of your location. After calling 911, follow the dispatcher's instructions. If appropriate, the 911 operator will instruct you to begin CPR with a technique based on the rescuer's level of training. Step 3. Administer naloxone. If the person overdosing does not respond within 2 to 3 minutes after administering a dose of naloxone, administer a second dose of naloxone. These are administered in alternating nostrils every 2 to 3 minutes. Naloxone should be administered to anyone who presents with signs of an opioid overdose or when opioid overdose is suspected. Naloxone is approved by the FDA and has been used for decades by EMS personnel to reverse opioid overdose and resuscitate individuals who have overdosed on opioids. Research has shown that women, older people, and those without obvious signs of opioid use disorder are undertreated with naloxone and as a result have a higher death rate. Therefore, it is also important to consider naloxone administration in women and the elderly found unresponsive with opioid overdose. Naloxone can be given by intranasal spray and by intramuscular into the muscle, subcutaneous under the skin, or intravenous injection. All naloxone products are effective in reversing opioid overdoses, including fentanyl-involved opioid overdoses, although overdoses involving potent, example fentanyl, or large quantities of opioids may require more doses of naloxone. Duration of effect. The duration of effect of naloxone depends on dose, route of administration, and overdose symptoms, and is shorter than the effects of some opioids. The goal of naloxone therapy should be to restore adequate spontaneous breathing and not necessarily complete arousal. More than one dose of naloxone may be needed to revive someone who is overdosing. People who have taken longer acting or more potent opioids may require additional intravenous bolus doses or an infusion of naloxone. Comfort the person being treated, as withdrawal triggered by naloxone can feel unpleasant. Some people may become agitated or confused, which may improve by providing reassurance and explaining what is happening. They really need to explain more that this is actually people are put into sudden opioid withdrawal syndrome, which is more than feeling just a little bit unpleasant. The safety of naloxone. The safety profile of naloxone is remarkably high, especially when used in low doses and titrated to effect. When given to individuals who are not opioid intoxicated or opioid dependent, naloxone produces no clinical effects even at higher doses. Moreover, although rapid opioid withdrawal in opioid-tolerant individuals may be unpleasant, it is not life-threatening. Naloxone can be used in life-threatening opioid overdose circumstances in pregnant women also. The FDA has approved an injectable naloxone, an intranasal naloxone, and a naloxone auto-injector as emergency treatments for opioid overdose. People receiving naloxone kits that include a syringe and naloxone ampules or vials should receive brief training on how to assemble and administer the naloxone to the victim. The nasal spray is a pre-filled, needle-free device that requires no assembly and can deliver a single dose into one nostril. The auto-injector is injected into the outer thigh to deliver naloxone to the muscle, intramuscular or under the skin, subcutaneous. Once turned on, the currently available device provides verbal instruction to the user, describing how to deliver the medication, similar to automated defibrillators. Both the nasal spray and naloxone auto-injector are packaged in a carton containing 2 doses to allow for repeat dosing if needed. Fentanyl-involved overdoses. Suspected opioid overdoses, including suspected fentanyl-involved overdoses, should be treated according to standard protocols. However, because of the higher potency of fentanyl and fentanyl analogs compared to that of heroin, multiple doses of naloxone may be required to reverse the opioid-induced respiratory depression from a fentanyl-involved overdose. Many antidotes report more rapid respiratory depression with fentanyl than with heroin, although other reports do not reflect such rapid depression. Because of these effects, quicker oxygenation efforts and naloxone delivery may be warranted with fentanyl-involved overdoses compared with heroin-only overdoses. However, naloxone is an appropriate response for all opioid overdoses, including fentanyl-involved overdoses. Step 4. Support the person's breathing. Ventilatory support is an important intervention and may be life-saving on its own, even without Narcan. Rescue breathing can be very effective in supporting respiration, and chest compressions can provide ventilatory support. Rescue breathing for adults involves the following steps. Be sure the person's airway is clear. Check that nothing inside the person's mouth or throat is blocking the airway. Place one hand on the person's chin, tilt the head back, and pinch the nose closed. Place your hand over the person's mouth and make a seal and give 2 slow breaths. Our trainings now instruct people to give first 2 quick breaths. Watch for the person's chest, but not the stomach, to rise. Follow up with 1 breath every 5 seconds. That is also 1 breath every 3 seconds for children. Chest compressions for adults involve the following steps. Actually, we don't use chest compressions, so we're going to leave that out. Chest compressions are only used for the heart attack, not for the overdose. Unfortunately, this was done by the government a few years ago. Step 5. Monitor the person's response. All people should be monitored for recurrence of signs and symptoms of opioid toxicity for at least 4 hours from the last dose of naloxone or of discontinuation of the naloxone infusion. Lakewood Ranch Hospital here in Sarasota, Florida, I've had reports now that they have released young people in under an hour after their overdose. One was revived by his sister who had Narcan I had given her, and one died. People who have overdosed on long-acting opioids should have more prolonged monitoring. Most people respond by returning to spontaneous breathing. The response generally occurs within 2 to 3 minutes of naloxone administration. Continue resuscitation while waiting for the naloxone to take effect. Because naloxone has a relatively short duration of effect, overdose symptoms may return. Therefore, it is essential to get the person to an emergency department that you trust and other sources of medical care as quickly as possible. And even if the person revives after the initial dose of naloxone and seems to feel better, I now train the public that they need to also go with their loved one to make sure that they are not abused and neglected in the hospital as part of the training that I give people. Signs of opioid withdrawal. The signs and symptoms of opioid withdrawal is an individual who is physically dependent on opioids and may include body aches, diarrhea, tachycardia, fever, runny nose, sneezing, goose flesh, sweating, yawning, nausea or vomiting, nervousness, restlessness or irritability, shivering or trembling, abdominal cramps, weakness, tearing, insomnia, opioid craving, dilated pupils, and increased blood pressure. These symptoms are uncomfortable but not life-threatening. After an overdose, a person dependent on opioids should be medically monitored for safety and offered assistance to get into treatment for opioid use disorder. If a person does not respond to Narcan or naloxone, an alternative explanation for the clinical symptoms should be considered. The most likely explanation is that the person is not overdosing on an opioid, but rather some other substance, or may be experiencing a non-overdose medical emergency. In all cases, support the ventilation, oxygenation, and blood pressure should be sufficient to prevent the complications of opioid overdose and should be given priority if the response to naloxone is not prompt. Do's and don'ts when responding to opioid overdose. Do attend to the person's breathing and cardiovascular support needs by administering oxygen or performing rescue breathing and or chest compressions. Do administer Narcan or naloxone and utilize a second dose if no response to the first dose. Do put the person in the recovery position on the side if you must leave them unattended for any reason. That's top, arm, and leg bent so the person does not roll over. onto their face. Do stay with the person and keep the person warm. Don't slap or forcefully try to stimulate the person. It only causes further injury. If you cannot wake the person by shouting, rubbing your knuckles on the sternum, center of the chest or rib cage, or light pinching, the person may be unconscious. Don't put the person in a cold bath or shower. This increases the risk of falling, drowning, or going into shock. Don't inject the person with any substance, salt water, milk, or stimulants. The only safe and appropriate treatment is naloxone. Don't try to make the person vomit the drugs that may have been swallowed. Choking or inhaling vomit into the lungs can cause a fatal injury. All naloxone products have an expiration date, but current research has found that even under the most extreme conditions of even boiling and freezing, that Narcan is easily good for up to decades after the expiration date. Never throw Narcan or naloxone products away. They're valuable even after they've expired. If you receive more that is more recent and you don't want to keep the expired Narcan that you have, please donate it to a local health department or a local harm reduction organization like the one that I run, and we'll be able to reuse it. It's valuable and can be used. Thank you for caring about our opioid crisis.